There is no role more important than advocating for health and human rights. Charlize Theron. I'm not biased because I'm from South Africa, Charlize Theron asserts on her country of origin. The Oscar winner has been one of Hollywood's most successful actors and producers for more than 20 years, but her heart is still in her own nation. She describes it as one of those really, really special places. Anyone who has ever been can inquire. I've never heard anyone discuss the nation in such a negative light. However, she also experienced trauma from growing up there in the 1980s during the start of the AIDS epidemic, which continues to rack the nation to this day. She remembers, I was about 10 years old, and people around me were dying and scared. Not many people knew at the time that it was HIV and AIDS, but we now know that. It had a lasting impression on me that I have never been able to get rid of. After Theron relocated to the US in the 1990s, her acting career surged following breakout parts in 2 Days in the Valley and The Devil's Advocate. Nevertheless, she states, I was looking at how I could be of service because I wanted to still be a part of my country in a proactive way. She established the Charlize Theron Africa Outreach Program in 2007. One of the group's initial projects was the deployment of mobile clinics in South Africa, which it did in collaboration with Oprah's Angel Network, that provided youth with HIV prevention programs. Theron claims that although these transportable units were a good beginning, she soon realized they were a drop in the bucket. The AIDS epidemic was being caused by a number of factors, therefore she and her colleagues would need to broaden the scope of CTAOP's work to include more health and education programs. The idea of growth seemed intimidating. Theron remarks, it's a pretty high mountain to stare at, and the shadow is pretty dark. But change just doesn't happen if you're not brave enough to enter there with people who can guide you and really be the ones with the solution. After 16 years, 33 community-based organizations in southern African nations, such as Rwanda, Zambia, Zimbabwe, and the Democratic Republic of the Congo, have benefited from CTAOP's assistance. The group punches beyond its weight despite having just 4 full-time employees. It has broadened its focus to include programs tackling gender-based violence, health, education, and vaccine equity. The KZN Network on Violence Against Women, which prepares rapid response teams for the KwaZulu-Natal province of South Africa, HIVSA, an organization committed to creating an HIV-free generation, and the Biomedical Research and Training Institute, which offers public health researchers training and support services, are some of the program partners of CTAOP. Executive Director of CTAOP Ashley George states, we're trying to prove a model as part of what we're trying to do. We would love to be able to demonstrate how, by giving our partners more power, our impact differs from traditional philanthropy.